If you think about it from just the perspective of the disease itself, these are metabolic disorders. Nutrition has an impact on metabolism. There are certainly allusions, if not, straight up research related to this in either PBD or in other rare diseases. Just sort of starting there, thinking about, well, this is a metabolic disease. The things that are affected are things that interrelate with diet and nutrition. So perhaps if you modify diet and nutritional intake, maybe that can have an impact on the management of the disease. I knew anecdotally that there were lots of parents that followed specific diets for their children. That in itself was also very motivating to me to really try to explore what can I bring to the table with this nutritional background that I have to help move this sort of knowledge base on the understanding and the management of PBD-ZSD further. And then when we started doing some digging into trying to understand the role of nutrition and diet on PBD, but also other rare diseases, I just really started realizing that there's really not that much done with respect to trying to look at whether or not dietary interventions play a role in affecting the impact that the disease has on our children and our families. I think there are things that we can do, meaning absolutely no disrespect to people that have done research prior to, what we're doing now. I just think that there are ways that we can do some of this research better. And one of the things that I wanted to really explore is, can we take an account of what a child with PBD is eating using input from their parents and their caregivers? That's like one of the sort of tenets of my research now, is that, caregivers and parents, especially with diseases like PBD, where, a lot of times the kids cannot verbally communicate as effectively as is needed for a research study. The caregivers really hold a very important role representing their child in studies like this, where we can capture information from the point of view of the caregiver on behalf of their child. I was just saying this at a talk that I gave for Rare Disease Day, where I said, I'm not the expert on this disease, but I am the expert on my child, and my child's state of health is something that I probably know the best, other than my child. So if this information can be used for research purposes, then, we hold a very important role, especially if we do this, collectively. Maybe if we gather all these people that are experts on their child with PBD, maybe we can get more information about PBD from these caregivers.